Hi, I am Dr. Ramani C, consultant plastic, cosmetic and reconstructive surgeon working at Manipal Hospitals Whitefield. Today we are going to talk about congenital hand anomalies. Hand or finger deformities which are present at birth are called congenital hand anomalies. A child learns to grow with the use of his or her hand, and the interactions with the environment are with the hand at the initial stages of life. So any deformity involving the finger or the hand is a challenge for the newborn. Congenital hand defects or deformities can arise due to genetic mutations which can come within the family, which is hereditary mutations, or it can occur as a spontaneous mutation, or it can also be because of environmental factors like drugs, radiation, nutritional deficiency, etc. Assessment of a child with congenital hand deformity starts with history of the pregnancy, the type of delivery and their medications during the time of pregnancy, and family history, and also any related anomalies or abnormalities in the family as well. Initial investigation for assessment of a congenital hand deformity will be always an X-ray comparing with the other normal limb or even the foot. The aim of management in a case of congenital hand deformity, like in a case of an additional finger or an absent thumb or fused fingers, will always depend on the functional assessment of the child as to how mobile and stable is the fingers, wrist, etc. And with respect to the general body, any other associated anomalies are all ruled out involving the face, ears, spine or other bones. Most of the defects or deformities are managed at the time of around 6 months to 1 year. That is when the child learns to grasp object using the thumb, index and the middle finger. And some of the anomalies like a constriction ring because of an amniotic band, which can happen at the level of wrist or at the fingers, causing a compromise in blood supply, needs an immediate attention. Most of the anomalies can be managed once the child reaches around 1 year. Most common congenital anomaly of the hand would be what is called polydactyly, or an additional finger, which can happen on the side of the thumb or on the side of the little finger, which may be functional, or it may be just an extra skin and fat which is hanging. It may even contain bone and joints or even tendons. Treatment of congenital hand involves surgery in the form of removal of an additional finger or separation of fused fingers to create a functional hand, as hand is an elegant organ that defines the human species. Apart from surgery, there are other methods which will play a part in the management of a congenital hand anomaly, like splinting, stretching, physiotherapy, correction of contractures with release of contractures to allow the fingers to grow proportional to the age of the child, use of skin grafts or flaps, and correction of bony deformities. Surgery allows for the full potential of growth of the involved hand or the finger, and the child is easily able to incorporate the operated part as a whole in their routine activities, and there is a decreased psychological effect as the child can mingle or socialize with their friends